This is Jerry Hesch from Hesch Institute in Aurora, Colorado, and this is an example of a hypomobile pelvis. When I attempt to take up the slack on the anterior pelvis, there's no movement at all. And I'm using a very appropriate amount of force, and I'm doubling that force, and there's no give whatsoever. It should give in the same way that her femur moves to a stop point. That's called taking up the slack. And then I should be able to get a little more motion through the knee joint, and it should spring forward and bounce back. And that's a normal spring test. But on her pelvis, there's no movement whatsoever. Let's have you lie on your stomach, please. She has spring mobility going superiorly on both sides. She has spring mobility springing the top of the ilium on both sides. Now it gets interesting here. When I go inferiorly, I can actually take up the slack, but it takes up really quickly. We quickly run out of movement. And then when I try and add a spring test, there's no movement there. Her sacrum does not glide inferiorly. There's no inferior glide mobility. There's no backward bending mobility. I'm going to check the camera angle. There's a little bit of forward mobility. So this is the PSIS, that demarks the S2 level, which is the transverse axis of sacral forward and backward bending. And so the heel of my hand is on S1. And I can take up the slack, and then I can spring it, and there's a little bit of give, a little bit of spring, a little bit of recoil, and then I come up half an inch, and now I'm on L5. I can feel that being deeper, and I can load it, and I can spring it. So what I'm going to do is put 2 pillows under her stomach, a pillow under her ankle to relax her hamstrings and bring her lumbar spine into flexion. And then I'm going to capture the sacrum and glide that inferiorly. And I will do that for 3 minutes. And that should restore inferior glide, and oftentimes that restores backward bending. And I think we're unloading the lumbosacral facets. I think that's where the action happens. I don't think I'm moving sacrum inside the ilia, but no one's done the research, nobody knows. So whether it's a sacroiliac treatment or a lumbosacral facet treatment is unknown. But I do know that the technique is effective. After that, I'll have her lie on her back. Go ahead and roll over.
Whoa.
Sorry. Let me put that headpiece back in there. Alrighty. So then what I'll do is I'll have you hug your right knee to the outside of your right shoulder. Okay? And I'll have you do that for 2 minutes. And that's something I'll have you do every day. So the bent knee points outward to the outside of the shoulder, and you'll do that for 2 minutes. And that helps restore backward bending of the pelvis. And we'll do that on both sides. So I'll stop filming and I'll go ahead and start the treatment, and then we'll film your response to treatment.